this project was being motivated by as a lecturer, one of the students who was at a terminal ill stage. And then unfortunately for this student, he got a total burns. And then about 3 of her family members died. And at the point in time when we were looking for, when we did the spiritual assessments, was identified that this client or this student needed a spiritual support system. But it happened that it was so difficult for one to be able to get a religious leader in Ghana, because we are the minority group, to support this terminally ill patient who was at the verge of dying. So this is one of the motivating factors that gave the motivation of this researcher to develop a culturally sensitive palliative care guideline for Muslims inpatient in the tertiary hospitals in Ghana. So the outline of this will be introduction, problem statement, research, significance, conceptual, then we'll look at. So with the background, it is evidence has suggested that about 56.8 million individuals need palliative care globally. However, only 14% of these patients receive it. And we have about 1.8 billion Muslims in Ghana, which comprises of 19.9%. So we are the minority. And it has been established that disregarded requests for religious rights during palliative care may result in feeling of isolation, abandonment, and spiritual discomfort. And this has also, this study was being done by Malik 2020. Hence, the call for the development of this palliative care guideline to support people in Ghana. The problem that the researcher envisaged was that in the Ghanaian sociocultural setting, we have conversation, people have it so difficult to talk about death or even dying among families. It's a taboo to talk about death. People feel as if even the name calling of death within you and your family members is something that people do not want to even hear. And so the issue about palliative care is also not well known, even in Ghana among the health sector. It is a challenge, even within the health sector. Health professionals are finding it difficult. At which point are we supposed to invite the palliative team to render services to the dying, left alone to the minority, and to also consider their spiritual needs? Due to this limited guidance on the specific religious needs for Muslim patients, healthcare providers may overstep boundaries and cause unintentional harm or trauma to patients and family receiving palliative care. Hence, the need to specifically tailor palliative care to provide this minority group in Ghana. The aim of this study, it is a PhD project that is still ongoing, hence we still have an aim to achieve. The aim of this project is to develop palliative care guidelines specifically tailored for Muslims in Ghana, and to also, phase 1 of the study would look at exploring the perception and the needs of Muslim patients and their caregivers receiving palliative care. The same, we also look at the role of imams, so the religious leaders in Ghana, what are going to be their roles in helping in the palliative care services. And then the final one, we want to see the willingness of these healthcare providers in Ghana to how are they going to culturally accept and implement these guidelines into healthcare. Now, the second phase of this study is going to look at a scoping review, of which we are still not gotten, it's still not yet done. So we are going to assess and describe existing literatures among Muslims and evaluate the current palliative care guidelines available within communities across the globe. Hence, we'll be able to identify if there are any gaps, then we'll try and then work along. In the phase 3 of this study, we'll look at the consensus building to obtain viewpoints from experts in order to develop this culturally sensitive program. Now, what is going to be the significance of this study? What is important? Muslim patients in Ghana would have improved quality health care during receiving palliative care. Would also be able to develop a framework in Ghana that could be used locally and internationally. So, for instance, if Ghana is able to develop, Nigeria, we have similar cultural, background. So other African countries or sub-Saharan African countries could also look at it and then probably adopt. And then it will also serve as an educational tool for healthcare professionals regarding the unique needs of Muslim patients receiving this care. And it will also fill the gap in the low and middle income country, and other researchers can also replicate in other African countries so that we all come together to develop one common guideline. Now we want to look at the conceptual framework that guided it. It was by Sounder. Here she believes in the physical, spiritual, social, and emotional. But the researcher aim is going to be really focused on the spiritual, where we are going to see how the imams, their input, would they help in the recitation of Quran? Would they assist patients on even how to pray? So we have Ibadah friendly project that is ongoing, seeing how best we can support patients who are bedridden on how to pray whilst bedridden in order, in case they are going to die, they die peacefully and go back to their creator. And then also we'll look at the emotional support system, the family caregiver support, and the preferences of the Muslim based. So this is what the framework that we'll be using. Now we have some few definition of concepts. Because of time, we'll not be able to go through it. And then design, the methodology of the projects is we have a pragmatism approach is what we used. And then design is going to be qualitative, exploratory, descriptive for the stakeholders, whilst we use Prisma SR framework and then eDelphi. And then, so basically, these are some of the designs that we use. And the researcher is going to ensure that we go through it, and then there's going to be rigor and trustworthiness. There's going to be credibility, transferability, confirmability, and dependability to ensure that the study is going to be able to be replicated in other countries. Again, ethical consideration will be ensured that it will be met, where it's still also under review and we are still working on it. But I decided to share this opportunity and this project so that in case we have other people who have the interest in policy development. So this is the timeline for the project, which is ongoing. And also the budget was also shared. Thank you very much for your attention. Before I conclude, I want to emphasize that this research is open and we are looking for people who are interested in policy development. If anybody on the panel are interested, you could get in touch with the author, who is the principal investigator. I am the principal investigator, and we could see how best we can collaborate and work together for the purpose of our people. Ghana. Thank you very much, and thank you very much for your attention.